Welcome to Evan and Deb in the Evening, brought to you by Health, Wealth, and Wisdom, bringing you news and happenings from around the Bay Area and the medical, financial, and general wellness experts that help you live longer, stronger, and richer lives at any age. And now, from the Senior Voice America studios, here's Evan and Deb.
All righty, it's Evan and Deb in the evening, hour 2 here on Thursday night. We're live, and we've got some great guests. We're going to be talking about the dangers with over-the-counter medications. A lot of people don't realize how, mixing or matching them doesn't always work. They don't always match. All right now we got Sherry Torkos with us, and she's an award-winning pharmacist and health author that can talk to us about the problems when people mix or try to match over-the-counter medications. Sherry, welcome back to Evan and Deb.
Hi, thanks for having me on the program.
Our pleasure. So tell me, and people think, well, they're over-the-counter medications. So I could take one of these, those, and all of a sudden, before they know it, they're in a little bit of trouble, right?
Yeah, that's right. I think there's an assumption that because you can get products over the counter without a prescription, that these products are safer and they don't cause side effects and interactions. And the reality is that side effects with over-the-counter medications can be quite significant. Some of these drugs can cause problems with sleep disorders. They can affect your kidneys, your liver. They can cause ringing in the ear, depending on, the drug that we're talking about, the category. So I think it's just important for people to be aware of some of the possible side effects and also to consider some natural alternatives, because as I'm a pharmacist, and I do believe in the value of prescription and over-the-counter medications for certain situations, there's also a lot of things that we can do naturally to help promote healing.
All right, we've got Sherry Torkos with us, and it's sherrytorkos.com is her website. We're talking about dangerous over-the-counter drug interactions. So now, sedative and sleep aids, these can be real dangerous in the wrong hands or maybe used incorrectly, right?
Yeah, that's right. Prescription sedatives, tranquilizers, pills that people take to help fall asleep at night, they can cause loss of short-term memory. They're addictive. You can get a bit of a dependence and tolerance. But even the over-the-counter sleep aids, you have to be careful because some of them can cause pretty pronounced side effects. And interestingly, the active ingredient in most of the over-the-counter sleep aids are antihistamines. And they're actually being marketed for their side effect, which is the drowsiness that they cause, which is interesting because if you look at, for example, antihistamines like Benadryl, people use that when they have allergic reactions. If they have, runny nose, they have hives, you use Benadryl. It contains an ingredient called diphenhydramine. Well, that active ingredient, diphenhydramine, does cause pronounced drowsiness, and so companies got clever and they now market it for its side effect under different names. So interesting. That happens quite often in the pharmaceutical field. We find, companies find out about side effects that may be beneficial for treating certain conditions, and then they market it that way. But I'm not a huge fan of those types of products. A lot of people tell me, that when they take those things, they feel drowsy the next day. And the antihistamines that are in these sleep aids can also cause really pronounced dry mouth, dry eyes. And especially for people age 50 plus, that's a problem because a lot of people that are over age 50 do already have issues with dry eyes, dry mouth. So better option to help improve sleep and also to reduce stress is something called Suntheanine. And this is an amino acid that makes you feel more calm, more relaxed. It improves sleep quality, but it's not addictive, so you're not getting the side effects that you see with the prescription or the some of the other products that are used for treating sleep disorders or stress. So the Suntheanine, now that's just the ingredient name, so if you're in a health food store or pharmacy, you could look for natural factors. They have a Suntheanine on its own, and then they also have a sleep formula that has the Suntheanine in it. And there's another company called Tomorrow's Nutrition. And Tomorrow's Nutrition, they have the Suntheanine in a chewable tablet. So for people that have difficulty swallowing tablets or capsules, that's one to look for. Basically just makes you feel more relaxed so you can sleep better at night, and interestingly during the day it helps to improve your mental focus and clarity. So you get the benefits of better sleep at night and more alertness during the day. So that's really one of my top recommended alternatives for sleep aids.
And what do you say to people? I have friends that do this, that they'll go, I need to get some sleep, I'm going to go take a NyQuil. To me, I think you could get to, maybe it's not physically dependent upon it, but all of a sudden you need something now to go to sleep, right?
Yeah, you can. You can get dependent. And in fact, the ingredient in NyQuil that makes you sleepy is this antihistamine. And it's not good to take that regularly. If you need something occasionally and you're not sleeping because you have cold symptoms, maybe go for the NyQuil. But if you're having trouble sleeping on a regular basis, you have to look at what the underlying cause is. For a lot of
turn
people,
on the Golf Channel.
Yeah,
that's what I do.
Me, that would do it too.
if I have any problem going to sleep, I just turn on the Golf Network, and I'm within 5 minutes.
Yes, that is a snoozer. But doing something relaxing, developing good sleep hygiene habits. So avoiding caffeine later in the day, making your bedroom dark and quiet so that it's nice and peaceful. But if your mind is busy and active and you have difficulty unwinding, consider trying meditation, yoga, deep breathing exercises, and if you need a supplement to help you, I mentioned the Suntheanine because that does help reduce the stress, which often leads to sleep issues. But